So it's hard to tell now because I've had his legs wrapped for the last 24 hours, probably closer to 36 hours. So it kept the swelling down, but big old boy Oscar has developed a case of cellulitis. Humans can get it as well, but he got a cut probably somewhere on his heel that we're not even finding. It got infected with bacteria, and it causes their legs to flare up. And he's had cellulitis in the past, so he's a chronic cellulitis horse. Once they get it once, they're more prone to it. So part of treatment for cellulitis, you're going to deal with cold hosing the legs, which is what we're doing. Movement is good for them. And you're going to pressure bandage, wrap them with standing wraps, as well as get them on some antibiotics. Uniprim is what we're using. Vet prescribed a 10-day dose, so 10 days, morning and night. So he'll be fine. It's just something else to treat. It costs money, obviously, but it's nothing that's a life or death situation. We just got to treat it. So the orange on his legs, that's from using a solution called ball solution, which helps tighten the leg up. With him having the cellulitis, I will put sometimes the ball solution or Thermaflex, or I'll do a Fur's Own Sweat and then wrap it with the standing wraps. Do not wrap polo wraps for standing wraps. Don't wrap the standing wrap without the quilt underneath them. You have to use the quilt and the actual standing wraps and apply even pressure without any wrinkles. And I never pull tight at the back end of the tendon because you could cord the tendon. So you got to be real careful with that. But this is horses. They are a never-ending trauma fest. So this is how you would wrap the legs after doing the cold hose. I do like to tie the tail. It helps keep it out of the way so it's not constantly ending up in the wrap, because that can be a bit of a pain in the butt. And then you have your quilt. This is called a no bow quilt. I don't have the same kind on both sides. I just didn't have them handy. He was a pain. He just kept lifting his legs, which makes wrapping very interesting. But you figure it out eventually. But this is a no bow. It's specifically made so you can't bow the tendon by wrapping too tight. And I like going inward with the pull. Some people say it doesn't matter. I've always been taught you don't want to wrap away from the tendon. You want to go with the tendon to the inside. Then you just take that standing wrap bandage and you start from the top. Some people start from the middle. I start from the top. And again, same direction. You're going to pull from to the inside. Try to keep all the wrinkles out and the bumps out. And you're going to go around from the top to the bottom over that quilt that you put on. I pull tight at the front and not at the back. I don't want to apply too much pressure over the tendon just because I don't want to risk cording the tendon, which can be really bad. But after you go all the way to the bottom, you just start overlapping and go back to the top. Ideally, you're going to end your wrap at the top of the leg, and you're just going to Velcro it back on. And then you go around to the other side. So it's not horribly hard to do. He makes it a little bit more challenging because he doesn't want to keep that leg down right now. Is it because of pain? Is it because he's tender or just having a bad day? Or is he just being finicky? I couldn't really tell you because I'm not him and he doesn't talk. This quilt is just a regular quilt. It's not the no bow. It's just a quilt. So as you see, I went going towards the inside again with the wrap. You see how hard it is to wrap this thing with his leg up in the air. And I'm not so sure he's not going to try to kick, so I'm trying to be pretty cautious with that because I don't want to get kicked in the face by a hoof. But it's challenging when their leg's up in the air like this. It is definitely easier if they'll keep their leg down, but this is just what I'm dealing with. As you can see, he was able to knock his knot out of his tail, so now I've kind of got to try to also avoid the tail, which is a bit more of a pain sometimes. But that's how you would wrap the legs. The pressure bandage helps to keep their leg from swelling and helps compress it, so that way it stays lower in a sense with fluid retention and filling up. You don't want too much like puffiness and swelling in that leg because you want that tendon to stay tight. So the swelling kind of gives it that chance where the tendon can bow easier, so you're just trying to keep a lot of that away. But that is how you wrap it. So I figured I'd show you guys what cellulitis looks like when it's not been wrapped and it's had a chance to kind of swell. This bump here would not normally be here. It's not as bad as it can get. It's gone down. Some of the heat in his leg is going down, which is a good thing. But we got some scurvy going on because of the swelling. It kind of split the skin. But you see how his normal legs should look. They're a bit puffy.